Hello everybody, welcome to Team TDF Wellbeing Webinar. My name is Irena and I am one of the practitioners at TDF, and I am an acupuncturist. Today's session will be of acupressure. We will learn how to do acupressure when you suspect you have COVID-19, you are sick, you don't feel well, and you have abdominal symptoms. So today we are going to learn how to help yourself or anybody else that is around and is not self-isolating from you. Please make yourself comfortable. Turn off your phone to silent mode. All the distractions turned off. Always talk to GP first, or if you have any doubt whether to try acupressure or not, remember it is a complementary treatment. Each webinar covers one topic and I explain location of every point from basics during each webinar. So if you are here for the first time, I am pleased to welcome you and I hope you enjoy the session. The guided part will end at 12:30. Do close your eyes if you feel comfortable to do so. I will summarize everything we are going to practice today at the end of our webinar. Please remember to participate according to your own abilities. Acupressure has no side effect beside possible bruising and soreness of points. Please apply an amount of pressure that you feel comfortable with. You can stop and start at any point during the webinar. You are in charge. So let's begin. So today we are going to learn how to do massage if you are unwell, you have fever, you are sick, and in addition to all the other symptoms that we know COVID-19 presents itself with, you have abdominal symptoms. So you may feel abdominal distension, you can feel abdominal discomfort, you may have diarrhea, you may have vomiting. So if you have such symptoms, in addition to the other symptoms of COVID-19, this is the acupressure massage that can help you. So without further delay, let's start. So the first point that we are going to use today will be Sanjiao 5. I will just turn on the timer. Sanjiao 5 is located above the wrist. So it's two tsun, one tsun is one thumb width above the wrist on the midline between the bones there. So let's press this. To make most of the acupressure, I decided to show you how to combine 2 points together in order to achieve better effect with acupressure. So this point works very well with other point. Please continue on pressing this point. I will show you the other point, the location. The other point is located on the feet. So it's located between 4th and 5th metatarsal bones. If you start extending and flexing your toes and you slide your finger through, you will feel the tendon there. So the point is right behind the tendon. So ideally, what I want you to do is to press this point here and press this point here. You can see the mark is a bit not on the midline, but I had my hand in different position when I was pressing before. So ideally, combine these 2 points like this, if you are able to. If not, it's perfectly fine. Just press one point and then press the other point. So remember the gallbladder 41, flexion, extension with your toes, and slide your fingers between the bones here, and you will feel the tendon here. That's right behind the tendon on the lateral side of the body, lateral side. It's the point located. So now, let's do the other side. To thumb width from the wrist on the midline between the bones. Feel the bones. It's important to find the bones. Everybody is different. And just feel the point. Feel the bones. And you see when I am rotating my, that's the mark I'm pressing. When I'm rotating, it changes a bit position. So don't mind it. It's on the midline between the bones. So press it, and then we'll do the same thing with the other side. So again, let's go from between the bones on the feet. Just slide it, feel the tendon here, and just go right behind the tendon when you slide. Start from toes. Yes, it's on the lateral side of the tendon. The tendon is here. It goes like this. It's the little toe extension branch. Sorry. So you press here and you press here. I can see the mark here. Press these 2 points together. Let me show you. If you can't do this, press one and then press the other point. If you are sick, you may not feel well enough to do this yourself, but please do as much as you can, or ask somebody else to help. The other point is pericardium 6, and it's paired with as well, like previous pair of points. So it's located below the wrist. If I have my hand like this, press your fingers like this, and the point is again on the midline, and it's right under the index finger. You can make mark. That's how I find the point again. You can make mark with your nail to know where the point is located. And the pair point for this is located on the side, medial side of the feet. And first you find, this is the metatarsal bone, the first metatarsal bone. Just slide your finger on this bone and you will feel the head of the bone, and stop there. So try to press this and press this point at the same time. You can do this on the floor, on the couch. Just find the best position for you, so you'll be able to press both of these points. They work best when we press them together. When you have acupuncture, the needle is inserted in this point and in the other point, so it makes it easy because the needles are just there, so they work together. With acupressure, it requires a bit of gymnastics. but it's possible to do so. Let's switch to the other side. So first, BC6, pericardium 6. It's located on the midline between the tendons. You can make fist and you can feel the tendons. So it's here. Let's make a mark. See? And then let's find spleen 4 point. So it's, you slide on the bone till you feel the head of the bone. The end of the other end of metatarsal bone. And now you can press here and press here. Yeah. I know where it is because I made a mark before, so it's easy to find. These 2 points work together very well. The rest of the points will be easier because we won't pair them. Remember, if you can't press both points at the same time, it's fine. As long as you use acupressure, as long as you press the point, it's fine. So the next point is located 3 tsun above the wrist. Oh, sorry, 3 tsun above the midline. So it's your hand width actually, or you can measure with your toes, but it's easier this way. And it is located on the midline again. This is Sanjiao 6. And just press. Try to realize how hard. Try to find out what works best for you. When you are sick, you want to stimulate those points, but then you don't want to feel too much pain. It can be slightly uncomfortable. We switch to the other side. So the wrist is here, and the point is just right here on the midline. Just stimulate it. The technique is up to you. You may keep on pressing it, or press and lift, or do rotations, one direction, the other direction, clockwise, counterclockwise. It's up to you. Just press this point. You can do acupressure to somebody else. You can do acupressure to yourself and to children. We switch to next point. So next point is bladder 13. It's located on the back. It's located on the level of third thoracic vertebra. So the most prominent one, when you bend your head, is the seventh cervical vertebra. So you just can find the third vertebra and go below it, and it's located 2 finger width away on the side. So between the scapula and the spine. And just press these points. If you are not sure whether you are at the right vertebra, just press the one that is higher and the one that is lower. There's no side effect. Important thing is to find the right one. We are speeding a bit because there's lots of points. I'm sorry about the speed. I'm showing you everything, so you can do it yourself at home. The next point is REN 12. It's located on the abdomen. So it's located in the middle, between the sternocostal angle and umbilicus. It's in the middle. Just press this point. and midway, sternocostal angle and umbilicus. It's in the middle. Again, just press and lift. You can press and lift, press and lift. And next points are located like to soon 2 finger width away from the umbilicus, with like this, and it's here. It is stomach 25. Just press this point. Press and lift, press and lift. Ideally, when you are using acupressure, it's the ideal situation is when you feel some warmth and a bit of soreness when you stimulate points. So whatever technique works for you, giving this outcome, warmth and a bit of soreness, use it. Okay. Next point is located on below the knee. So let me stand up and let's. So this point is here located. This is fibula, the head of fibula. It's a bit difficult to find. You may try to go along the bone and here on the lateral side, and you will find the fibula. The point is located a bit anterior and inferior. It's actually 1 finger, one thumb width away and under. It's gallbladder 34. So once more, how to find it. The fibula, the head of fibula, it's here, and you go here and this way. So on the other side, the head of fibula is here, so you got a bit to the anterior side and inferior. So anterior, inferior directions, and you are at the point. Gallbladder 34. It's sore point for me today, and I'm trying to massage it to help it dissolve the soreness, the sensitivity. I'm using lots of force. The next point is spleen 9. It's located on the other side, and it's located usually on the same level. So to find it, just run the fingers into the groove posterior to the middle border of the tibia, and then until you just find the depression below the tibial condyle. Just go like this, and then you'll find the depression and press it. To find this point is easy, and it's located usually on the same level as gallbladder 34. So you may press them together. I'm sure you can still feel the location of gallbladder 34. Now, if you are doing acupressure to children, let's find on the other side. So again, run the fingers into the groove posterior to the medial border of the tibia until you find the depression below the tibial condyle, and press. So again, it's more or less on the same level. So regarding children, the pressure you use is gentle, like if you were checking if the cake is baked. Very gentle pressure. With adults, it's a different story. Just press. You may change fingers, you may change hands if you are not doing 2 points simultaneously. The next one is located from popliteal crease and medial malleolus. It's in the middle. So run your fingers to the middle, and we are at the right level then. And now two width of fingers away from the tibia and press from the anterior crest of the tibia, to be more precise, and press this point. It's stomach 40. You may press constantly with the same pressure or change the pressure. So from popliteal crease, just find the midline, that's the level. And now from the anterior crest of tibia, 2 finger width away from it to the lateral side. And press. It's stomach 40. Just press. I will sit down. Please continue pressing. Continue pressing at this point. So we are going to press the last 2 points. So continue pressing. So now the last point I left for to be the last one, because this is the point that helps stimulate immune system. So the point is located. Here are the eyes of the knee, the 2 depressions. So when you place your hand like this, the point is located one just under your hand, 1 middle finger width away from the anterior crest of the tibia. So it's here. And press this point. Let's make mark here. So I know where is this point. Yeah, the mark is there. Let's find the same point on the other side. So it's here, yeah, eyes of the knee, 1 hand width below, and 1 middle finger width away from the anterior crest of the tibia. The point is here. So let's continue pressing these points till the end of our webinar. I left this point to be the last one, because this is the point that helps strengthen immunity. So by just pressing this point for 5 to 10 minutes each day, you help to boost your immunity. And if you catch something, you are stronger to defend yourself from whatever you may catch. So just press this point for 5 to 10 minutes until you feel warmth and slight ache. Stimulate this point. If you can, just go to your acupuncturist and ask for stimulation of this point by using needle. It doesn't require that much strength, and you can relax during the procedure. So all the points we went through today are used in a scenario that you suspect you have COVID-19 and you have the symptoms that we know of COVID-19, but you have as well some abdominal symptoms. So you may have diarrhea, you may feel discomfort, you may be bloated, you may suffer from vomiting. So this is how you can help your body with acupressure. So please continue pressing stomach 36. I'll just explain the whole procedure. Where from is it? So it was the procedure was published in June 2020 in English-speaking country. So this is based on Chinese government guidelines regarding the pandemic. So the title of the article is Acupuncture in the Treatment of COVID-19, an Exploratory Study. It was published in Journal of Chinese Medicine. So you can find it there. It is available freely to everybody that want to look into it. So you can have a look there, and if you have any questions, any suggestions, any feedback, please write to therapysupport@tdf.org.uk. Last week we did scenario when you suspect you have COVID and it attacked the lungs, so you don't have any abdominal symptoms. Well, the other thing that is important to remember that having a cold, having a flu, or having COVID, but we don't know much about that yet, it's not static, it's dynamic. So you may not have in the beginning the symptoms in the abdomen, but they may come in a day or so. So just watch your body and try to help yourself. So the last week's webinar, I was showing you the acupressure points to help yourself when you suspect you have COVID-19 and it attacked your lungs. And this week, when you suspect you have COVID-19 and you have abdominal symptoms as well. Please have a look at the article. So that's the article. And if you have any questions, just write to us. Thank you to everyone who participated today, and please attend again. Please else tell your family and friends if possible, and if you like the session, please support the charity's work. Thank you. I wish you to have a wonderful weekend, to stay healthy, safe, and see you next week.